Hello everyone, this is Peter Reimer of TriTech Information Systems, and Clinic Essentials is our product. So we're about to start the webinar here. We're at 101 and it looks like all but one have arrived, so I will start. So Clinic Essentials is a clinic management software primarily for fee-for-service clinics, so clinics like wellness clinics, chiropractic clinics, massage, physiotherapy, naturopathic. We pretty much specialize in those. We have a couple of other types of practitioners only because they are also in a wellness clinic, and so we have made a few facilities for those, but primarily the ones I mentioned are the ones that we work with. So I'm going to log into Clinic Essentials. We do have restricted access if you want to restrict users to only perform certain functions. I'm going to log on as the administrator. I don't have a password. I just left it blank, but you can certainly password each one. The first thing the program does is ask if you want to print a patient recall report. It does this the first time you log in each day or until you've printed the report, and it is a function that you can turn on or off. Now I'm looking at the schedule for today for one practitioner. This is Dr. Frost's schedule. We always show one practitioner schedule at a time. So as I scroll through practitioners, there's Dr. Aristotle, Dr. Burrows, Peter, a massage therapist. So you can have various practitioners in the clinic all have their own schedule. We do have a view that shows you all schedules of all practitioners that are in today. So in the case of where you want a patient wants to see the first available practitioner, or they may want to see more than one practitioner while they're in the clinic. Perhaps they're getting chiropractic treatment and massage treatments in the same day, and you want to be able to organize that. We have a screen that allows you to do that. I'm going to work primarily with Dr. Frost since that's where I have most of my demo database. And I'll just draw your attention to the right for a minute. We see that we're on the 18th today, which is in red, so that's the current day. And you should also notice down the left side here that all of the time increments there in yellow. So this gives those are both indicators that we're on today. If I move to another day, the yellow disappears on the time increments, and I can move to any day of this month, next month. You can use pull downs, or you can just keep clicking through the months to get anywhere. You can always put an appointment anywhere you want as far as in the future as you need. When you're ready to come back to today, you can just hit the Today button. It'll come back to today. Scrolling through practitioners, you can either use a practitioner list to jump to another practitioner, or we can go to the next practitioner alphabetically or the previous practitioner. So we have several ways of moving between practitioners. So now to put an appointment into the scheduler, what you do is click the spot where you want to put an appointment. So if I wanted to put someone in treatment room at 2 o'clock, all I do is click on the 2 o'clock spot. And what that does is it sets the time that I actually want to make the appointment and the column number. You can name your column numbers here. You may notice that I've named my column numbers treatment room, laser, and decompression. Those names can be anything you want. You determine what those names are. But right now the program knows that I've clicked on 2 o'clock in the first column, and the cursor's flashing a name and wants to know what's the name of the person that I want to put in that spot. So if I start typing a name, say I just type Smith and press enter, it pops me the list with the first Smith or the closest match. Now, if I was to say, instead of typing Smith, I would type Smith, comma, Amy. If there's more than one Amy Smith, it would pop the list. Oh, I didn't even spell it right. It would pop the list if it finds more than one, or if it can't find an exact match, it'll pop the list. Otherwise, it normally just fills in with the patient information. You can see their insurance number, their phone number. The next thing you normally want to do is fill in the reason of why they're coming in. The reason list, again, is user definable by clinic, so if you've got different kinds of treatments in there, this list starts off blank and you add the ones that make the most sense for you. So massage therapists typically put their different massage treatments in. Chiropractic may have different chiropractic treatments they do. A lot of people like to have ones showing new patient. And when you're setting these reasons up, you can say what the text that you want to be appear in the schedule when you book the appointment, what's the default amount of time slots you want this to automatically block off for you, and what color would you like it to show on the schedule, and also what direction you would like to use the extra slots or block off extra slots. So horizontally means, in this case, we have 8 slots and we're 3 columns wide. So it'll go across before it goes down. So it'll go 3 across, go down 1, and go another 3 across, go down another 1, and go 2 more. If you went vertically, it'll stay in the same column. So how this is traditionally used is chiropractors quite often, they look at their schedule just as how much time they have to spend with a patient, but they may have multiple columns, and they like to use horizontal. Other therapists that work more just in one room at a time, and maybe have a second column just for doing different types of treatments or to manage hydrotherapy or something else that they do, they typically want to block the time vertically. So that's just options that you can have in there. I'll leave this, well, I don't need to change anything here. I was just showing you how that works. And if this is just a regular office visit, I can either select it from the list, or you can just type it here and it'll fill in. So either way, that works. So an office visit here is just going to be like a 15-minute appointment, and that one's colored gray. So just to show you that one more time, you pick the spot, type in a name, press enter, and I'll take Jessica. And it'll warn you if this patient normally sees another practitioner. That may or may not be what you want to do. In this case, that's fine. They see Dr. Burrows for a different type of treatment, but they're going to come in and see Dr. Frost today. And let's say they're going to come in for something that's, well, Dr. Frost doesn't do massages. I don't have any. He's going to do some decompression, and I will put it. And actually, after you have talked, are in discussions with the patient, you can change your mind where the appointment should go. So I initially clicked in column 1. Here I'll click in column 2 and save the appointment there instead, and it's going to go in for decompression treatment. Booking new patients is slightly different. So if I go down to 3 o'clock here and say that I want to book a new patient that's never been in this clinic before. So let's say the name is Weens, Jessica, and the software tells me that we don't have a Jessica Weens in the database. Do you want to make this a new patient? Do you want to add the patient right now, or would you like to look up and see if there's a different spelling for Jessica Weens? But if we're talking to the patient and say, oh, we see you haven't been here before, is this the first time you're in the clinic, then you just click new, and the software then asks for a phone number before it asks for a reason. So if her phone number says 534-8950, then in reason, we would put NP for new patient and save the appointment. So I did not ask Jessica for any other information other than her phone number. It's just to get her appointment into the schedule, and then we'll get the rest of the information when she actually arrives. So that's kind of how you add a new patient for the clinic, or put existing appointments in. The one other thing I'd like to show you is here how to put multiple appointments in for a patient. So if I say select, let's see if I have Peter Reimer. Oh, fix my typing there. And I've got 2 Peter Reimers. I'll pick that one. And I want to book an appointment for 4 o'clock today. I'm going to save that appointment. And I'd also like to save one for next week and the following week. And we'll get a few appointments in there. So now what I can do, I can come back to today, and I can look to see how many appointments does this patient have. So I just click on Find Appointments, and I see that he's got Tuesdays booked for the next several weeks. What I can do is I can actually print a calendar. I'll just hit View here so that you can see it. I can print a calendar that shows all the appointments that he has for this month plus the following 3 months. And this calendar has custom notes you can put at the top and at the bottom if you have cancellation policies in the clinic and so forth. So this can be given to a patient that has multiple future appointments booked, rather than giving them a whole bunch of little cards that have the appointment times written. So I just wanted to show you that as well. Okay, so Ashley Reimer, one more thing here. I'll show you what happens if an appointment is late. If I book another appointment here for somebody that was supposed to come in this morning, say Brenda Smith, and I booked that. The appointment actually goes pink 15 minutes after the appointment time. So here, Brenda was expected to come in at 10:30. Whatever color this appointment was before 10:30 changes at 15 minutes after 10:30 and goes pink. That's just to help you become aware that, oh, there's a patient that hasn't shown up yet, and follow whatever the policy is in the clinic, whether you call their cell phone to find out if they're still coming in or what your protocol there is. So I just wanted to show you that as well. Okay, so I'm going to click on Ashley. If I arrive her now, I've got a warning message on this patient. You can put warning messages in for patients and say that you want them to pop up. It's optional on all patients, but I've seen the warning now, so I'll click OK, and it turns the appointment green. So Ashley's now arrived in the clinic. Any other computers on the network would see that appointment turn green and know that the patient is now in the waiting room. When I'm ready to bill Ashley, now whether you bill before the treatment or after the treatment, if I click billing, it opens up an invoice screen to bill Ashley. So you can put templates in your billing, or you can pick from all of your fee codes. You can have a fee code of thousands of records in here of different fee codes that you may want to charge. But what happens is a lot of clinics maybe only have a few primary fee codes that they use all the time, and they can put those into what we call templates. So I've got a template here called F1, which if I name it F1, it means I can use F1 on the keyboard to bill it, or I can click on it there and it's just going to bill for a subsequent chiropractic visit. Now I happen to have GST turned on this chiropractor, where typically GST is only charged for naturopathic clinics, which is about to change, and massage therapy clinics and a few other modalities out there. But in this case, it's going to bill $40 plus GST. This patient normally likes to have an invoice, so it's defaulting to print invoice. I'm going to change it to view invoice, and it remembers this on each patient. I could email the invoice instead if I want. Then when I hit save, it would actually send the patient a PDF file of the invoice rather than it coming out the printer. I'm going to do view so that you can see what it looks like. The payment, it automatically assumes that the patient's going to pay for this invoice. Now I can pay more or less just by typing over that value, or I can say they're not paying today, which means it would just go on account and then it would ask for this money the next time the patient comes in. I will leave it to payment. This is probably the most common case for offices out there, is you ask a patient for money and they usually pay. I also see that Ashley paid cash last time, so it has remembered that she likes to pay cash. Now, if she changes her mind and pays Visa this time, then the next time that I invoice Ashley, it'll remember that she last paid by Visa and assume that she probably wants to do that again. I can change the value of this invoice. I can add more lines to it. I can charge for product if she wanted to buy a pillow or something while she is in. And anything can be done with this invoice before we click Save. I'll click Save, and it posts to the ledger, and up comes a copy of one of our invoices. Now, we have several styles of invoice. This is a full page. We have half page, third page invoices. So we have some flexibility. We have some room to put a logo on here for the clinic if the clinic would like to have their logo on. So what this shows is the name of the clinic at the top. Right below that is the name of the practitioner. If they want registration numbers on there, you can tell it to put the registration numbers on there. And it's got the patient information on here as well as the invoice information. And then what you were charging the patient for and how much the patient paid. Now this patient happens to have a $450 credit on account. They're probably prepaid for some orthotics or something. And on the left side, you can have a note that prints on all invoices if you want. And it also shows their next appointment if you have already booked a future appointment for this patient. So some clinics, what they do now is before they bill the patient, they book the follow-up appointment so that when they print the invoice, the appointment, their very next appointment actually prints right on the invoice. So this would normally come out the printer or go out through email, and then you're back to the ledger and Ashley is now blue. So blue means that Ashley's been billed. Doesn't mean that she's paid. In this case, she did pay, but it does mean that it's been entered into the ledger. It'll be included on the end of day reports, and if she didn't pay, then the next time Ashley comes in, it will ask for that money, or if we print accounts receivable reports, it will show that Ashley does owe this money. So that's typically how 90% of the patients are dealt with all day long. Now, Jessica is a new patient. So Jessica is going to be a little bit different. I can arrive Jessica already, so I'm just going to assume that it's now 3 o'clock and we will arrive Jessica. So when I click the Arrive button, it looks for Jessica in the patient list and it doesn't find her. If it did find her and it was just spelled slightly differently, we could click on it and it would just correct the spelling in the appointment. But what usually happens here is this is a new patient, so now she's filled out the input sheet and we want to fill in the information on the appointment. So it starts, brings up the screen to add all the patient demographic information. So I'm just going to quickly bounce through these fields here and explain what they're for. So last name, first name is pretty straightforward. Salutations, if you want to do any kind of mailings or anything to this patient, you may want to put their title on it. So I can go Miss here. Alternate name could be if this patient, her name is Jessica, but perhaps she likes to go by Jessie. So if we put Jessie in here, it'll always print Jessica on the receipts and on statements, but on her appointments, it'll show Jessie so we know how to address her when she comes in. Chart number will be automatically assigned by the system unless you have pre-numbered charts. You can type your chart number and the system will just check to see if the chart number already exists, and if not, it'll allow you to use that. Registration date is today, so that's to help you with new patient reports. We can always pick a date range for new patients, and Jessica became a new patient on March the 18th. Health insurance number would be a care card number if you want to do any kind of billing to either MSP, ICBC, or WCB, then this needs to be filled in. The other number is any other number that we may want to track on this patient. And if this patient is going to have any billing to WCB, then it can be very helpful to type in the social insurance number here, and it'll be used on WCB reports. Birthday is pretty straightforward. It shows month, day, year. I'm going to put in here 03/19/2000 just because I want to show you how we work with birthdays in the schedule. Automatically fills in the age. It's marked her as active. Now you can remove the active flags for patients that are no longer active in the clinic, and that just shortens your patient list when you're browsing for patients. You don't have to go pay attention to all active patients, so it gives you the ability to shorten your list. Marital status is optional. You can fill it in or leave it. Gender must be filled in. Since we have some gender-specific reports, and to do any electronic billing, the gender must be indicated on the record when we send it to any of the healthcare companies. Patient group can be used to put your patients into groups. So if you ever want to do any marketing to a certain group, say Jessica's a runner and we maybe want to do a running clinic for all the patients that are runners, then the system has the ability to give you a list of all the runners and give you their email addresses or their address or print labels for them so that you can market your seminar just to runners or any other group that you want to have. The address, pretty straightforward. City gets defaulted to whatever city you set as the default city. So in this case I have Vancouver, same as province and country. And zip code, I'll put a zip code in here. Now it took the phone number from the appointment and already filled it in here. If that's the home phone number, then that's fine, or you can move it to work or cell. Cell has become very popular now, so I'm going to fill in a cell number for her too. And primary, it wants to know what is the phone number that it should show you on each appointment. So if you're going to call to either let them know that the appointment needs to be rescheduled, or you want to do a appointment reminder call, this just tracks which call that Jessica may want to be called on, or which number. So I'll change it to cell because that's quite common now. Email address is so that we have the ability to either email appointment reminders or email statements or email receipts. Then this needs to be filled in. So I'm just going to put Jessie@mail.com in there, and that would give us the opportunity to send mail to that email address. Now, default bill to means that this patient would normally be paying privately. Now, if this patient has MSP coverage, then we would change it to MSP. And that just means that the first $23 of the first 10 visits will be paid by MSP, and after that, the system will automatically switch the bill to and bill the patient until the end of the year and then start with MSP again. So that's typically all you need to fill in on a patient. But since we're on the screen, I just want to show you a few of the other things that we do track on patients. Practitioners, who's going to be the default practitioner for this patient? It can be anybody in the clinic. Now this patient can see other practitioners if they choose to in the clinic, but it just shows who's the default practitioner. You can also track who's the family doctor for this patient, and this is a list that you could build over time, and then you can just pick who the family practitioner is. You may also want to come into this tab to find out how the patient heard about the clinic. And we find there's 3 primary resources for getting referrals to the clinic. Probably the most common one is patient referral. So if she was referred by another patient, clicking this lookup here pops us into the patient list. It's in last name order, meaning that I can right now just type a last name. So I can look for another Ween in here and see if I have any other Weens. I don't. Oh, I got a Ween. So maybe Agnes referred Jessica, so I can press enter on that, and that just tracks the fact that Angus actually referred Jessica. What this is used for is if you're doing end-of-month new patient reports, it will give you a list of all your new patients for the month and where the referral came from. Or you can do something called referring list reports, which is the same list, but it would show Angus Weens referred however many patients. And you could also have some that maybe came from the website, how many patients came off your website. Or if you have another practitioner doing any referrals, then it would show how many came from Dr. Steve Smith and so on. Referral type is only used by specialists, so that was one of those cases where we have a couple of sports doctors that get extra fees from MSP if they've been referred by the family practitioner, so they use that. Visits, all we do in the Visits tab is calculate constantly how many visits this patient has had. The top is how many have been billed to MSP, and the bottom is just keeping track of how many visits, cancellation, no-shows that this patient has both this year or total since you started using Clinic Essentials. The Insurance tab would only be used if the patient is being treated in regards to an accident. So if it was an auto accident, the left side would be filled out with the claim number and the adjuster. If it's work, then workers' compensation side would be filled in on the right side. We also have coverage for third fields to fill in if you're doing any billing to Department of Veteran Affairs, RCMP, or Department of National Defense. Those you can fill in the third-party information then, so that it doesn't ask the patient for money. Instead, you would print off an invoice and send it to Pacific Blue Cross or whoever happens to be the company that would be paying for these visits. Notes, any notes that you want to pop on this patient or store on this patient, if you want them to pop, you put a check mark in the display warning. So for instance, if this patient has an allergy to massage oil or something like that, you may want to put that in here and put a check mark in the top to remind every time the patient arrives, just remember they have an allergy to massage oil. That can be used for whatever you want. Comments is any text you want to save on this patient, whether it's dialogue with an ICBC adjuster or anything like that. And it's not shown anywhere else in the program. We just keep track of it in here, so that's for your use. Images are for those clinics that possibly take pictures of their patients. It's common for some chiropractic clinics to take posture pictures, on the first visit, after 5 visits, after 10 visits, and so forth. The software doesn't take the picture, but you can link to the picture in here. So it just has the ability to track pictures for patients without you having to remember what the JPEG file names were and so forth. In the other tab in here, you can fill in the occupation and employer information, which is really helpful for WCB reports. We also have a few other optional things here you can do on the patient. For instance, whether or not they only want a receipt at the year end. Assigned means if you do send an invoice to MSP that you want MSP to pay the clinic, not to pay the patient, or you can direct them to pay the patient. Whether or not this patient actually pays for the fee, or have you agreed to do free visits for this patient, whether they're a staff member, a close family member, or what have you. The other thing that's quite helpful in here is you can show that this patient is the member of another patient's family. So for instance, if say this patient was related here to Joseph Reimer, so that if the patient didn't pay their visit, then it'll check Joseph Reimer and see if Joseph left money on the account for maybe his daughter to use. Or when Joseph Reimer next come in, it'll check to see if Jessica owes any money, and then it'll give you the opportunity to remind the patient that, oh, your daughter was in and you still owe money for that. So it just creates a link between family members and allows you to manage outstanding amounts a little better. This is the same field, whether this patient has MSP coverage or not, so I'm going to leave it there. And the ICD code is just what's the diagnostic area that you want to let MSP, ICBC, or WCB know that you've been treating this patient. And finally, appointment reminders. Does this patient, would they like no appointment reminders? Would they like phone calls? And most clinics do this the day before, where they'll do their phone calls, or you can have an email or text message. I'll put this one down as a text message just because then it checks to see if they have a cell phone number in here, which this one does, so it did not complain. But finally, it wants to know who's the carrier for their cell phone. And we do this because it made it a free text message for the clinic. So if I say that this is a cell phone number, oh, time missed, and I can actually hit the test button. Looks like my mouse is not agreeing with my screen right now. There we go. I can click the test button right now. If I was connected to my email engine right now, then I could just hit test and it would check to see, to make sure that this, right when the patient's standing in front of you, you can just say, well, I'm going to test this reminder message. Let's see if you get this within, the next 15 seconds, and you can hit the test button to do that. But like I said initially, normally all you would fill in is the left side of the screen unless there's other information that you want to fill in. So I'll hit save there. So what it does when you arrive at a patient, it checks to see if the patient's birthday is within 3 days of today. And if so, we pop this message just to let you know that it was the patient's birthday. It's going to be tomorrow, and so you can say happy birthday to the patient. And now we're ready. Jessica now exists in the system. We get to see her information. She now has a chart number. So we can actually bill her. And if it's an initial visit, she has MSP coverage, so it bills the first $23 to MSP. And then we've said that looks like an initial visit costs $73 here, so it's asking the patient for an additional $50. Again, it's defaulting to print invoice. That's where it starts off with. If I'm going to say I'm always going to email instead of print, or I can do both, it'll remember that on this patient, and maybe Jessica pays cash. So when I click save, it should just send that email message out. I can have templates here for email invoice, and this is what it'll say. Sends it to her email. Subject is your invoice. And this is all editable by you, how you would like this to be stated, but it says hi, and then whatever the client's name is, please find your current invoice, and it's for the last appointment date, regards, and what the professional name is of the practitioner. Like I say, these are customizable by you. If I hit send, that would just send the email message out. So now that email message has gone to that person. And Jessica is now blue, same as other patients. So ideally, at the end of the day, you'd want the patients to be blue. So I've covered a lot of things there about the scheduler, and if you want to make a note of any questions you have, we will have a Q&A at the end of this session. I'm approximately halfway through, actually a little more than that. Then Carolina is going to take over for me, and she'll answer any questions that you may have. So one thing I didn't cover there in billing is inventory management. So if there is any inventory management while we're billing here, and I showed you how you could look at the list of the fee codes, we see all the fee codes in here, and there's a column whether that's, if inventory management is turned on for the clinic, there's a column here that says yes, and when I edit that, it will keep track of how much inventory I have. Well, that's an adjustment. That's not a very good example. Let's go to, say, this rehab ball pump. I've got 3 of these in stock, and my last cost was $3. My average cost is $3. And so every time I sell one, it'll reduce the balance on hand. It'll let me know if I'm down to my minimum. So the last time I sold one, it should have told me that I'm already down to my minimum. And typically the maximum would be a higher number. And it would just say that I'm running low and that I need to order some more. The other thing you can do is run inventory reorder reports. So anything that has the balance on hand that's down to the minimum already, it'll tell me how many to order to get back up to my maximum, and it would group that report by the vendor or the supplier that I purchased this from. The other thing you can do in here is manage what is the prices for these fee codes or for this product, and you can have different prices for if MSP was to charge. Well, MSP doesn't buy products, but if you did want to sell it to anybody else, say ICBC will cover some products sometimes, you could say, well, ICBC charges pays $25 for this product, and whether or not it has taxes on it. So you can manage all your prices in here, and it also manages how many you have on hand. You can do inventory evaluation reports, so for the end of the month or end of the year, it's very simple to tell how many dollars of inventory you have. The other thing it does for you when you turn on inventory is you have the ability to receive inventory in the system. So this is for when you have a box of product that comes in from your supplier with a packing list or an invoice, then you can pick your supplier, put down the invoice number, and now you can start receiving product. So any product that I want to receive, say I'm going to bring in some cervical pillows. Last time they were $123. Maybe the price went up slightly, and I got 5 of them. And it just increases the balance on hand of that product when I hit the post button, and keeps an audit trail of it. So that's just a way of receiving inventory into stock, and removing it from stock happens automatically as you're invoicing for these products. I'm just going to cancel the screen. The other thing I wanted to show you about then is reports. So at the end of the day, well, even if you're doing any scheduling electronically, then one of the things that we suggest is that you always print a day sheet for tomorrow. So we want to print that for tomorrow at the end of the day today. Preview that. So this would be, it gives a page for each practitioner again. So I have 2 practitioners that have appointments booked tomorrow. It puts it on paper any patients you're expecting to see tomorrow. And this is a good idea to do just in case the computer doesn't start in the morning, or the computer's been stolen, or the power is out. If there's any reason that you can't see your schedule on the computer, then at least you have a paper backup and you know who you're expecting when, and where you have empty spots where you could slip a patient in that happens to phone in. So we highly suggest that you always print tomorrow's appointments before the end of the day. End of day reports. Now this is for your end of day accounting. I will have a little bit of demo data in here already. So one of the things it prints is the daily charges and receipts. So it'll show a list of patients. We billed 2 patients so far. On each doctor, it would show how many patients we billed, how much. I can blow this up a little bit in case it's small on some people's monitors. So it shows the fee code that we billed them. It shows the amount that was billed to insurance, how much was billed to the patient, and how much the patient paid the clinic, and how they paid. At the bottom, there'll be a total for each practitioner of how much cash should be in the till, cash, check, or insurance checks if you got checks in the mail. And if you have a little POS card swiping machine, then how much will the end of day totals be on that? And this should match with the money that's in the till and the end of day report that comes out of your POS credit card machine. And again, it'll have one for each. I've only billed for 1 practitioner. Each practitioner gets their own page, and then on the last page is totals for the clinic. The other thing I'd like to show you here is that we have billed 2 patients so far today, so that's another number that you like to balance. A lot of people balance this with what they actually have on their day sheets or what the doctor has recorded in his or her system as how many patients they treated. But we also like to balance this number to the schedule here that shows that we have arrived 3 patients, but we've only billed 2. So we have a problem here. I'll blow this one up a little bit more too, just in case you can't see that. So this report shows that we have 7 appointments on the schedule. So there's some appointments we haven't done anything with. Something needs to happen to them. But we've arrived 3 and only billed 2. So we have a discrepancy. There's 1 patient that hasn't been billed yet, and that should never happen at the end of a day. And 4 patients that have no status yet, which means they haven't even been arrived, they haven't been no-showed, or anything. The other thing that this report will show is any patient that was new today, or if you have the recall system turned on, which I'll show you just briefly in a moment here, it will also show you any patients that don't have a future appointment and don't have a recall in the system, so they're about to slip through the cracks. So that'll just help you with patient retentions. Then you can call that patient and just explain to them that you didn't book the next appointment, or you can at least put a recall in for them so that whatever your policy is in the clinic, that you call them in a week and book their appointment, at least the recall will remind you to call them in a week. We also have reports for end of week, for doing any accounting you need for the end of the week, end of the month, end of the year. We have accounts receivable reports to show who owes the clinic money, all breaks down by patient and by practitioner. We have the ability to print all kinds of forms for patients, recall letters, and so on. We have the ability to print labels if you want to do chart labels or file labels. There's statements you can print for patients that have an amount outstanding at the end of the month and you'd like to get them collected. There's things like that. And then General has just miscellaneous report or product-related reports for reordering product and so forth. So in the system, there's actually over 200 reports now. So we've been doing reports since 1999. So usually just about any report that a clinic has need of, we've usually done it and we just add it to your list for your use. So I said I was going to show you a recall too. If I look at Jessica here, she doesn't have a next appointment right now, so she actually currently has slipped through the cracks. She didn't book a follow-up appointment, so what I probably want to do for her is just put a recall in for her and say, well, we want to call her maybe in 10 days, and we want to follow up appointment booked with her in 10 days. So what that'll do now is it'll on oh, and actually it had put in a default recall for her because we have defaults turned on. Most clinics don't use defaults. They like to actually define when they want the next recall to appear. So I've said on March the 19th, I want her to appear on the recall list, and we want to call her to make sure that follow-up appointment gets made. What will happen is if she is phoned in before March 19th and booked appointment, then this will get ignored on the report, or if you're just doing it on the screen, it'll show that she has already booked a follow-up appointment, so you don't need to call her. So that's how the recall system works. So the other thing I've talked about a little bit is appointment reminders. So most people do, like I said, was do that the day before. So today's the 18th, so you would probably want to do appointments for tomorrow. So I clicked on tomorrow and click on appointment reminders, and I get to see all the patients that want a phone call. I get to see the ones that I'm going to send a text message to, and then on the right would be anybody that I want to send emails to. And you can manage these a little bit. If you want. Let's say that Anthony Wilson, we'd actually like to email him rather than phone him. I can just drag him over here, and it says, oh, we don't have his email address. So maybe he gave that to us last time, so I'm just going to go tony@mail.com, and that would send Tony an email when we hit the send button. Now you could have a list of 50 patients on here. When you hit the send button, it'll send all of those 50 emails one at a time, and it will send the message that you create on here. So this one here just says hello client first name. So as it's working with each appointment, it replaces client first name with that patient's actual name. And we just wanted to follow up with you from your last appointment. Oh, this is actually not appointment reminder email, somebody's typed it in here. So, but this here is definable about how you would like the appointment reminder to read, and then when you save it, it just uses the same message each time. And it does the same thing by sending appointment text messages. So there could be a list of 20 people on here, and it'll send them all a text message at once, just telling them who the appointment's with, at what date and time that their next appointment is with. Phone numbers, importantly, unfortunately, you have to do the actual dialing. It shows you the phone number dial here, and maybe you want to just leave a note saying that, okay, I left a voicemail with this one, and confirm. So, and it colors that one down, showing that it's now done. Ruth, maybe, confirmed. I just talked to her. And so you can show, and as you do each one, it highlights them to show that it's been done. And it's the same if we had done our text messages and I hit send here, it sends out my message, and it would change the color of that. There, it sent the message, and now it changes the color of all the patients that it's already sent a message for. And like I said, it would do 20, 30, 100 all at one time if we were doing them all for one practitioner. You can do for just some practitioners, if not all like to send messages. That's totally designable by you. Okay. Electronic submissions to MSP, and actually ICBC and WCB use the same system right now. That is done with, if I close this screen here and I go to MSP Teleplan tools, it is sent through the Teleplan system. So in here, I can't do this because I'm actually not a bona fide clinic, but you would type in the password. The user ID for your Teleplan account is stored in here. You type in your password for this month and click log on, and then you can just click the submit button. It'll batch up all the invoices that are owed by MSP, ICBC, and WCB. You hit submit, and it sends that batch to the MSP through the MSP website. You do not have to go to the website to do this. Then you can also pick up your remittance. Once you're logged on, the retrieve button is available. So you would click retrieve. It would pick up any remittance messages that are in your mailbox at Teleplan and ask you if you want to post them, and you would just click post, and that's all there is to it. You can also do eligibility checks, but in here it's actually we've found an easier, we've put an easier way for that to do right on the patient screen. I'll touch on that shortly in just a minute. You can also change the password, which MSP makes you do every 39 days, so you can do that in here. Now, as far as the MSP eligibility, I'll just find a patient here that's maybe got MSP coverage. These are all patient, third party. There's one that has MSP, but this patient doesn't have health insurance filled in. As soon as there's a health insurance filled in, oh, here's one that's health insurance. So as soon as the health insurance is filled in, we add a little button here called MSP Eligibility. So if you click that button, type your password, it'll tell you in this screen right here, it'll tell you if they have any visits left this year or whether or not they're eligible for MSP. So you don't have to use the telephone IVR system to do this. You can do it right from within the software. But I will warn you that it's just as up to date as the IVR is. It can be a few days behind because they may not have processed all of their claims yet if they've been at other clinics. So MSP eligibility is there as well. We've just recently started testing our online appointment system as well, and I won't show it to you today, but I just wanted to let you know that there is the ability to have your appointments, your patients book their schedules online if you turn it on for a practitioner. And basically how it works, the patient just asks for an appointment date and time. The system will check to see if you have that appointment time available, and if so, it'll allow the patient to book it. If it's not available, then it'll suggest to the patient the closest 5 appointments, and if they don't want any of those 5, then they can just start over with new appointment time, and then those get sent to your scheduler every few minutes, and they would just pop into your screen. You can choose to accept them or deny them, and it'll just send the patient an email whether or not they've been accepted or denied. So it's just another way for your patient to book appointments in after hours if you choose to use that. The other thing that we get questions about it a lot is whether we have EMR, electronic medical records, and Clinic Essentials itself does not have electronic medical records, but we link to other systems, to EMR systems. So by linking, what I mean there is when you enter a patient into Clinic Essentials, we will update the EMR database of the patient's demographic information, their name, phone number, address, any information that you'd like in the EMR system, we can send that over there. And the same thing, when you edit a patient in Clinic Essentials, it'll automatically send the updated information to the EMR database. The other thing that the link does is when you arrive a patient in Clinic Essentials, like if I was just to arrive Amy here and click arrive, it would send that information to the EMR system so that the doctor knows that Amy's arrived, and when the doctor goes to pick the patient from the database, they appear on a short list rather than having to scroll through the whole patient database looking for Amy Smith. It'll just be there in just a short list of arrived patients, so the doctor can just select Amy and fill in the EMR information without spending any extra time on it. So we currently do that for 3 systems. ChiroRite, what's the other one? Easy Note and Daytrans Chart Plus. So those are 3 that we currently support, and we are willing to look at any other systems there too. So that's how the EMR or electronic health records or electronic medical record systems work. So that's primarily my presentation for today. We will now open it up to questions and answers. You can type in your questions and send them to us, and Carolina will take over and answer some questions for you. Thank you for your attention, and we hope to hear from you soon. And you can always email info@clinicessentials.com if you would like any further information. Thank you very much.